let's do some pediatrics, shall we? Epiglottitis. Now, one of our problems with epiglottitis is y'all wait till you get on this test and your punk ass forget what you remembered from peds because you didn't get a really good peds. You know what I'm saying? You just didn't. So when you don't get a good peds, you tend to forget this major player on the test. And I will tell you this right now. Epiglottitis, some kind of way, shape, form, or fashion, is going to show up on your test all cute and purty and looking crazy. Now, with our epiglottitis, it is one of the 5 reasons to call the doctor first. Here's what I mean by that. I give you 5 reasons why you're allowed to call the doctor first. And the reason why it matters is because too many of y'all want to fucking call the doctor. That's not going to be a good plan for you children, okay? So let me tell you. Your test is a nursing exam. They ain't trying to test what the doctors know. So you turfing your patient to a doctor makes you seem dumb as a rock. And you don't know shit. So fuck it, give it to the doctor. Hell no. You gotta realize you can't say that too many times on the test because they gonna think you boo-boo the fool and dumb as a box of rocks. So here's the deal. You can only, and I mean this from the bottom of my heart, you can only choose call the doctor one time on your damn test average. But there are 5 reasons to call them first. You can only choose one time because here's what I'm trying to tell you. You ain't gonna get all 5. An average is one only reason to call the doctor. Every other one of them questions, you gotta fix the damn patient yourself. So here we go. The way you figure out when to call the doctor is you gotta remember my mnemonic. It's called Reese's. The R is ruptured uterus. Now understand what I just said. If you think of a hand grenade or a bomb, that is what the fuck your uterus did with a baby in it. It just decided to blow. Now you might be thinking, oh, how does that happen? Oh, it only happens when a patient has had a previous C-section. And typically that previous C-section was trying her best to go vaginal. Now I had 100% success rate with these patients, so it is a great idea. The reason why I had a success rate is because I very cautiously chose which patients that I allowed to do that. For example, if you had more than one C-section, you wasn't allowed to do that in my practice. You better go find another doctor willing to do that dumb shit, because I ain't. If you had an incision that went up and down, oh hell no, you ain't finna do that. The up and down is real high risk. No. Because going like this, pop, is real easier than going like that. So no, we ain't doing that shit. If the reason for your C-section was the baby was too big, and you still sleeping with the same man who made that big ass baby, they only get bigger. What the fuck is we doing? Okay? What you doing? They not gonna go from 10 pounds to 2. They not. Okay? So, I had to pick which ones it made sense to go ahead on and let a C-section mama have a vaginal delivery. If you had a C-section for breech, you and me can do this. If it was for fetal distress, I got your back. But all these other obscure reasons, I don't know about that, is how I say it, okay? Now, here we go. Let's do it. When this happens, and it happened to me as an RN, and it is the most scariest shit you ever want to see. I'm sitting at the bedside. Oh, let me say that again. I know it's foreign. I'm sitting at the bedside. See, I was never one of them to be out there at the nurse's station talking about who shot John and who fucked Joe. Wasn't my cup of tea. That wasn't what I did. And nowadays, I was never at the bedside looking at my Instagram. Wasn't my cup of tea. Oh, let me come up your street and down your parking lot in case I ain't got to you yet. I was never one of those on night shift shopping on Amazon. I know you. I know who you is. No, I sat at the patient's bedside. I cared. I gave a damn. Just what the fuck I saw. I never forget it. And the only way I could have caught it was at the fucking bedside. Here we go. These is contractions. That's what I saw. Now, I saw that contraction. I saw that contraction. And for some reason, this motherfucker skipped out. Just left me hanging there. Hanging. I said, woo. She had an epidural. Do you think she felt anything odd? Hell no. So it couldn't have been any way to save her and her child's life unless I was at that bedside seeing that. So I saw that, and my natural instinct was to touch her belly to see if the motherfucking monitor popped off. Maybe the shit just popped off. And I said, no, that didn't happen. And instead, what I felt, and yes, you gotta know, was a rock hard brick-like abdomen. And then I saw proof of what I thought, because I was only a nurse a couple years. I didn't know this shit. I went right out of school into OB, and I mean, you got to work in OB a while to get real confident with what the fuck, oh Lord, with what the fuck be going on with these patients. And so when I put my hand on there to see if the monitor had popped off and felt that hard ass belly, and then this is what I saw next. Watch this, y'all. This is creepy. Real creepy. This is the fetal heart rate. Watch this. The fetal heart rate before that happened was happy. It would go up and just chill out sometime. It'd go up again with every contraction. And then it just do its thing. And then here we go. Watch this. It go up and... Oh, it was horrible. It was horrible. It was like soon after that happened, I screamed as loud as I can. I need help in room 9. I still understand the humble spirit here. I didn't know what the fuck any of it meant. I just know her belly was hard, this contraction stopped, and we went down right after that. When the doctor came in the room, she has a ruptured uterus, let's go! Screaming down the hall as fast as we can. Let's all hands on deck, call P's now. We're flying to the OR. In the OR, I'm sorry to any of you who didn't know how serious nursing was, but that scenario has 4 minutes to save a life. So you're gonna feel that cut. We did not scrub your belly. Oh, hell no. We splashed the betadine and sliced your kid out of you. Period. And all of it took less than a minute. She had an epidural. She was lucky, but had you not had one, you'd be screaming at that point. We'd be trying to give you a general, but we cutting you first.
So I had a placental eruption, and I didn't have an epidural. So they were
You felt this.
Yeah, they were coming in to give me the epidural. I was trying to push the long as I could, and all of a sudden, they were coming down the hall to come to my room, and all the sirens and lights started flashing because my heart and my son's heart stopped beating at the same time.
Oh.
And then they pushed everyone out of the room, and there was like 15 people on me and pushing us down the hall to the OR.
There's a lot of people.
Oh yeah. And my mom said she'll never forget the scream that I screamed when they cut me, because they cut me up and down.
Yep, we cut you this way because it's very quick.
She said it was the worst scream she's ever
And she
heard
knew that was her
in her
baby.
life. And they had 1 minute to save my son's life, and
Yep.
they had 3 minutes to save my life.
Exactly. It's that simple. It's that. I don't know nobody explained it better than you did just now.
My mom said when they opened the OR door and said, "Your grandson's alive," she said the whole floor was just red. And she said, "What about my daughter?" And they said, "She's not okay yet." And then they went back in. And then they knocked me out because, of course, I didn't have anything. And the
Yeah, we give you a
anesthesiologist-
general.
Yeah, he didn't realize that I was only 18 years old. And he didn't realize that I had never had any drugs in my life, like any pain meds.
Nothing.
And I couldn't take care of my son in the hospital because I was so sick and like just out of it. He apologized. He's like, I accidentally gave your daughter like the equivalent to street heroin to combat her pain that she was feeling.
You scream so loud.
And I didn't wake up really for like 3 days.
Oh, I believe that.
I couldn't take care of my son alone. They actually had to take him at night because they were afraid that if I tried to.
You'd fall asleep, honey.
Yeah.
Yeah, because some drugs take a minute to wear off.
So I didn't even like change the
This-
diaper or nothing until
This
I got
is
home.
just like that, except quicker. So you heard what she said. This is quicker. Because, see, what's happening inside the human body at this point is the baby is floating in blood. Has no lifeline, just floating in blood. Nothing is there to save him. Just floating around in blood. Okay? This is why people think, oh my God, I want to work in labor and delivery. Well, that's true. It's a wonderful field. And the way I say it to you, especially those of you going into it, because I went to it right after school, is it is moments of a high where there's no way on earth you could deny there's a God. Mixed with moments on earth when you'd rather you be dead than her based on what you just saw. Those are the mix you're going to get into with this. Because see, everybody knows one thing, and that is babies and mommies should never die. And when they do, it wrecks your world. Period. You work in ICU, that 92-year-old COPD now with CHF and pulmonary edema is gonna die. You can accept that. But the 19-year-old on Christmas Eve who never met her 8-pound, 6-ounce boy who was induced over 3 days with all her family at her side, and they left so she could rest, has to be called and told that she's dead? You can't fucking reckon with that. You can't. You do go home pretty fucked up by that. Because it's not the way it should have went down. Okay? So that's why you call the doctor first. You scream for the doctor. They have seconds to get things out. You feeling me? Okay. Next one is that epiglottitis that's on page 7. Now, thank you, Jesus. You will not see this as much as you used to. Dare I say it again? Fucking vaccines. Okay? That's for all of y'all who don't want to vaccinate your kids. You're fucking crazy on this one. Skip something, but not this one. You want to play boo-boo the fool? Fine with me, but don't skip this one. Now, your ass on your test got to know which one this is. What is it called? Hib. It's the oldest vaccine we have and the most effective.
What age they get it?
Oh, the baby want to know. I ain't mad at that
Mom's
child.
about to get hers real soon.
I know that's right. Here we go. 2, 4, 6 months.
Okay.
I have a little rhyming thing in the pediatric videos on HETV. So here, precious baby, the reason why American children don't die from this is because we've been given a Hib vaccine forever. So it's Haemophilus influenza B. It protects our children from epiglottitis. So when we see epiglottitis, it's usually from another country, and they don't have the same vaccines. These are toddlers. These are 2- and 3-year-old precious toddlers that did not get their vaccine for whatever reason, and they show up in our ER, and they are very classic in their presentation. They are very much having to be in a tripod position. They cannot breathe if you do this. They cannot breathe if you open their mouth. They cannot breathe if you take this baby, this little toddler, they can't breathe, and this is on your test, they can't breathe if you cradle them. This is cradling the baby. No, you have to keep them sitting up, sitting forward, tripod. They are going to die if you lay them back or open their mouth, period. You cut their airway completely off. So there would never be any on your test throat cultures. There would never be on your test an oral temperature. There would never be laying back for an x-ray. None of that. None of it. They must be kept sitting up. Your first nursing action, because that's what this whole little mnemonic was about, is call the doctor and have a trach set at the bedside. Because this doctor needs to intubate this child to save them. So you got your trach set so he can intubate this baby. Because it's such an emergency, you have a crash cart in the room. This is serious. Okay, so we probably see this 5 times maybe a year, and 99% of these precious children are not born in America. That's why you have to be so wise, because you don't see it that much. So you have to be wise what to do and how to recognize it. They have inspiratory stridor. Make sure you know they're going to be drooling. They can't swallow. They have no airway. So they're drooling. Okay? They're feverish. They have a sore throat. You can't know that because they're babies. They can't even talk. But truth be told, they have no airway.
I had a question, because I had a question similar to this on my NCLEX. It was asking basically, the baby was sick, but it was about shot schedules. So the baby was sick, and it was asking, like, the mom asked, can the baby get the vaccine once he got well? And I think one of the answers was like, no, he went past the months, or then the one was like, readjust on the shot schedule, or something along those lines.
It's a very good question. Put this down in your notes because it is on your test.
Yeah.
Babies can still get their vaccine when they're sick as long as they don't have a fever of 101 and above.
Okay.
That's the answer. So you want to remember, go ahead with the plan. Colds and coughs and things don't matter. What matters is that fever. If they have a fever of 101 or higher, then we say, okay, let's reschedule them. Okay. So this is the one on page 7, isn't it?
Yeah.
You know, you're calling the doctor first because you can't intubate. You're good. You're thebomb.com, but you can't intubate a baby. That's not your role. Your role is to keep the patient sitting forward. Never lay them back. Not until it's time to intubate this baby. Okay, babies, we got 3 more. Here, and it's probably on your little list anyway, so it's perfect. What is this C over here?
Compartment syndrome.
Okay, compartment syndrome. All right. Now, you guys know this is where we talk about the 6 P's and whatever it is. What you got, your paresthesia, your pain, your pulselessness, your paralysis, all that shit. You know this already. You're pretty good with this one. I don't have a problem with you guys with this one, but I have to make sure you understand the difference in when to call the doctor. You call the doctor first with a cast. If they are in traction, what is your first nursing action? Somebody said it. Release the weights. Very good. She said, did I? Okay, now, so here we go, right? We got to be practical here. You have a cast on your arm. And I have a child, a precious baby, who broke her arm either at 11 or 8 or something like that. She was riding a bike down the street. And, okay, Marissa looks like a chocolate drop with hair down her back. Beautiful. Like, whoa. Now, unfortunately for me, I had to beat every boy on the street off of her to get to my child. Because I got her, Michelle, I got her. I can carry her, I got her. No, you ain't got my baby. Go on somewhere with your little dusty self. Shit. Now, the baby. She fell off the bike. She has a broken arm. We go to the nearest ER. We go get this cast. Now, I love her nurse. Her nurse was excellent. She said, now, Marissa, when you go to sleep tonight, it's very important that you do not sleep like this or like this. What you're doing is you're making sure that you kind of elevate it a little bit, okay? You're trying to elevate it because we need the blood circulation to keep on moving in the arm. All right, now, Marissa was fine. Her mother was not. I was looking at the child sleep the whole time. Get in bed with your mama. Tell that man to go and lay in your bed. Now, so I watch mine. Now, the deal with the cast, if let's say that maybe she didn't get good teaching and she laid in such a way that the swelling kept going down the arm instead of the fluid returning to the right side of the heart and all that good stuff, it's called venous return. And so let's say that the baby didn't know no better. She slept with the little arm down, got all this edema. What would happen to the cast? Oh my God, it'd get real tight, wouldn't it? And the tighter it got, guess what it did? Cut off her circulation. Now, you have to know your little codes here. We said it's a bunch of P's. It's not enough to know all them P's. You got to know which P is going to happen first, right? So the first P, and we're going to write down all 6 of these old stupid ass P's. Here we go. The first P is going to either be worded like this or like this. Most likely, paresthesia is the one they like the best. Paresthesia is where you feel like you fell asleep on your shit, right? Y'all done did it before. You laid a certain way too long and the damn leg went numb on you, got the tingling and whatnot, prickly like little needles, whatnot. And that just means you laid there so long you was kind of cutting off the circulation a little bit on the side. Okay, whatever. That's exactly how this arm is gonna feel. And that paresthesia is your early warning sign. It's not a problem if you figure it out, right? It's very early, not a big deal at all. It just means there's some swelling and the cast is tight. We're gonna need to call the doctor. He's gonna need to saw it off. You're gonna need a new cast. You can't saw off a cast, so we need to call the doctor. But that was an early sign. Let's say that you didn't pick up on that sign, the patient didn't complain of that sign. Here's the one that's gonna get you the most. Oh, and by the way, pressure and paresthesia are very similar, if not exactly the same. But here's the one that you gotta know like you know your name. Pain unrelieved. If you put pain, you just missed the boat. It ain't good enough to put pain. You gotta put severe pain unrelieved with medication. Because what do we say? Well, of course it hurts, you broke your fucking arm. It's common sense. But this ain't that kind of pain. This is pain that you medicated and didn't shit get better. The pain scale is still 10 out of 10. Are you with me? Call the doctor. That's a very bad sign. And you're still early enough not to lose your license. Now let's keep on going because you might have been at the desk buying Amazon. Here we go. Am I lying? I think I'm lying. No, I'm lying. The color is going to disappear next. Because if you cut off circulation to a limb, your color going to look kind of weird. And the only way you really know that is you compare both sides. You take the hand on the arm that's broken and you take the hand on the arm that ain't and look at them. They're going to look completely different when this is getting too far gone. And you saw me writing the other one out of order, but I'm trying to keep these in order for my children. Here we go. Here go the next one. They can no longer do this. And remember, today we talked about a broken arm, but it could be any damn thing. They can no longer do this. And that's what you're supposed to be having them do every time you assess. They can't move. It's hard to move that finger, them hands. They can't do this. They can't do shit. It's getting to the point where it's no more return. You done gone too far now. Fucking around with that damn Amazon and Instagram. Okay, let's do the last one, y'all. What is it? And it's it. That's it.
Pulselessness.
Pulselessness. Well, you can say goodbye to your license, sugar. You didn't want it anyway, fucking around. Okay, now, so if you cannot find a pulse on this patient, that's a wrap. You can go on and call it quits. See, the complication of compartment syndrome is amputation. Because you fucked around and let the limb die.
Are the first two separate ones then?
They're similar because sometimes the test overlaps them. Okay. So if you don't see this, but you see that, that's first.
Okay, so it's 1, 2.
Yeah, it's 6 P's. Yep. So if you were to, let's look at this. Oh, I know. I have some of that here. Okay. So if you were studying musculoskeletal this week and you pulled out your ortho, the first thing you're going to see, because I know it's on the test, is the 6 P's. Okay? So they're not in any order on here, but that's where the video comes in, because I tell you everything I'm saying now. All right, so that's why they go with the videos. All right, so you let this patient get to the point where they can't even feel a pulse. Yeah, your ass going down. Okay, now here we're going to be amputation, or have to do some extraordinary surgery and take another vessel from another place and put it there and all this other kind of shit you don't need to know. Okay, but this is building. It was building the whole time. It takes hours to get there from here. So you was really on some bullshit that day. On your 12-hour shift, you was just fucking around. Well, you wasn't assessing shit. You was just forging paperwork, fucking around, lying in Epic and shit. You know how y'all do. Now, bye. Y'all done. See, you didn't even know. Clock is saying 4:40 and y'all still sitting here waiting on more. I'm looking at them. I'm like, they don't think they should go.
I got all night.
You know your life boring if you got all night with me. Lord, get that girl a sexy man.
I got all night for 3 days.
Oh, look at your little You know what, tomorrow? Y'all need to stuff it around. Now, if you know like I know, you can straighten up your shit and leave it. Right where it's at. Or not, I don't care. Put your name on your, oh my God, so you remember what you said. No hole punchers. Let me tell you what you need to buy. These. You know why I don't do the hole punches? Because y'all little shits leave the circles all over my fucking floor. But that's not really the reason. The real reason, because I care a little bit more about you than I do my floor. If you preserve them in these, I know that every LPN in this class is going back for RN because the day they took your LPN test, they could have passed an RN test because that's how high I teach. I also know that every RN in my class is either going to be a nurse practitioner or she's going to teach this shit. So you need to preserve it because our body didn't change because you changed careers. Save your shit. Yeah, she knows. She took her LPN with her. She knows she took her LPN with her. I didn't tell my Oh, you need the rope. Okay. Did you text the number? Oh, no. You got to put it. Hold on, I got the number, I got it. Okay, yeah. Okay, baby, did you get it?
Where are you going?
Yes, sir.
Okay, go in your thing.
$40 for a new one? I know, that's insane.
$40.
And that's the hotel, right to the hotel right here.
Okay, do this. Keep working.
As long as you can show me where it's at, I'll take it. That's just crazy.
Okay, baby, you got your thing.
Don't put your Thank you. I checked.
You want the pile of here?
First
You want
day
this?
I checked it in. I don't know what it say now. I checked it now. It said it's because it's busy.
Are you getting the whole thing, or what are we doing?
Yeah.
Okay, this one,
Everything.
yeah, the whole thing is 150.
Okay, and this thing is the whole thing.
That's everything, yes, and all my med pack, everything. Everything you see, like everything. This is 150, but if you walk out that door Sunday, it's 390.
regular, this is the regular.
So you want it Sunday? You wanna pick this up
Yeah,
Sunday,
that's
or you
what
want
I'm,
it now?
that's what I'm saying. So you
So that's
$69.
Or do you want it now?
That's what I'm saying.
Or do you wanna wait till you go fly home?
No.
No, you want it now?
Because if I go fly home, more than, right? Is that what you
No,
say?
if you leave here and try to order it later, it's online, it's not 99.
Yeah, that's why I don't
You can
want.
pick it up Sunday, so you don't have to
Yes.
carry this.
Yes,
You want that?
yes, I want.
Okay, if you pay now, I'll put it up so nobody gets yours.
Yeah, that's right here. They sent.
Oh, you just paid?
No, they sent the money. I told you I was
One for birthday. This is supposed
I didn't know.
I will make you one for Sunday, because I have to make another
Well,
one.
you
Okay.
you can hold it until I leave.
Yeah, I can hold it, but
Yeah,
when you
the
pay,
money's
is your name's gonna go on this.
Put my
thing.
name on it.
Okay, show me money, show me your money, I'll show you your name. Anybody else?
Yeah, I had a question actually about it. So with the NCLEX, you don't get all of it?
Okay, some of you are from, somebody needs the room, so that's important. Oh, so don't go anywhere. Okay, now, so if you're in Cleveland, I have very good news for you. The money you paid, if you're in Ohio or you wanna travel from Columbus or PA or New York, whatever you're gonna do, you're gonna be here and it's close enough for you to drive back and forth if that's you. Then the money that you paid for the course goes towards the regular course, so you don't pay more money. You just get that one subtracted from the fee that the course is gonna cost you. And then you just pay on a payment plan $100 a week. And then you get all of this, you stay in the class, you do whatever. This young lady did that, where'd she go? She was sitting here.
Yeah, I heard her, she told her, yeah.
Yeah, she came to boot camp.
This another look, the one
Yeah,
we went
this
to
one over
Chipotle
there.
when she told us the same thing.
Yeah.
She loved your class.
I
and
met
how
them
you
in
good.
boot camp, they liked it, they stayed, now they're part of the course, they got all the handouts and so on, so on, so on.
Okay.
So if that's something you wanna do, you tell me Sunday.
What's the course?
The course is 12 weeks or
We
more,
gotta stay
how
out
long
here.
it takes you to pass. And it's a limit of 5 months. Are you in Cleveland?
No, I'm in Chicago.
Oh, no, you don't wanna drive back and forth.
No, I
Yeah.
can't do that.
No,
Nothing
no, so
online?
you're gonna be okay, cause these go with every video I got.
So the video is free though, but we just don't have.
Videos are free.
Okay, but we just don't have
All
the handout.
900 plus.
I don't get
I
that.
put my whole school, everything I'm talking about up here is on a video already.
It's on the HTV.
HETV.
Yeah, what these are.
They go with it. Yeah. Okay, did you do it? Okay, let me go ahead and put this up. What's your name, honey? Chevelle. Okay, let me put this sticky note on here. I'll put them in my office. And we'll try to make more by Sunday. Do you have more? 31.
So it's on the.
I have. No, we don't have any fines in your pack. No, baby. But I'm putting this up for you.
You highlighted in there. What's not talked about in there is only this one. So that's why you look everybody has highlighted. Because what's talked about is already in her, that's already noted for you, you highlight. What's not noted, right. You don't rewrite, it's
Yeah,
already
you got
there.
pink now.
That's why you need all your highlights.
But that
Dang,
is
but that's
different.
150 for that.
That's all. That's every single subject. That's different from pink packets. Pink packets is just somebody else's tax. And that's why you see.
Yeah, all of this is
Okay, so
one
this
fifty.
one's not.
But don't forget, $400 before, $399.
So we brought,
Absolutely,
You want me to make you one? Okay, now, so I have two of you.
All right.
I have two of you. If I can make it for tomorrow, I'll give it to you tomorrow. But most likely it's gonna be Sunday.
Everything you're gonna do on that test. is what
Okay.
And if there's any place we can stay for tomorrow and Sunday, we are going.
She just took the last room that we were able to get.
Yeah, just texting.
I sure would like to do that.
They didn't text me back.
Oh, tomorrow we
Do
don't
you
know
need it or
where to
no?
stay.
No, I need it. I have nowhere to stay.
Oh, yeah, we got you. So, yeah.
Okay. Here.
Tomorrow,
Tomorrow,
I'm
I've already got a place for tonight and tomorrow. I'm leaving on Sunday.
You are leaving on Sunday. So it's
Yeah,
gonna
leaving
be
Sunday
Saturday
night.
night. What's tonight, Friday?
Friday.
Okay, you're doing Friday,
yes.
so you need one more,
No,
Saturday night.
I need Sunday.
Oh,
She
you
needs-
go on Monday.
Yes. I will
Okay,
be going.
when do you go home?
I go home on Sunday.
Oh, that's good, cause then your room will empty out and at least you'll get one of those. Yeah, so, let me finagle, I don't know about you two, but I'm gonna check. I know for sure we can accommodate you, is what
Okay.
you told me.
Okay, he can text me that.
What's that, that's her.
Oh, that's you?
Yeah,
Oh,
but
okay.
see, she
I'm
would
over
have,
here.
she would have gone and gotten everything ready.
But
you
nobody
never- texted her.
texted me.
Oh, cause I was so busy paying attention.
Right, nobody texted me, that's why I've been sitting here all this time. If somebody had texted me, I would've went and got
Some of
everything
us
ready.
in New
Well,
York.
that's me. Well,
But
okay.
you're gonna go in a room where the student is not coming back in November, they're on vacation, they're on holiday in another country.
Got it, got it.
Some of us in different states
Yeah,
want to come and even have live class. But
Well, we do
it's
have
still-
housing for that,
That's what I'm asking.
yeah, but there's only 2 rooms for that when everybody from boot camp and everybody coming from holiday. There will only be 2 rooms for if you wanted to stay, and it's first come, first served. And if you wanted to join the class
class.
itself,
Yes.
then you have to text me, you say, I'm interested in long-term stay. And the long-term stay is as long as you need, 12 weeks to 20. Cause the class gives you a guarantee, it's 100% guarantee that you're going to pass. And it goes as long as 5 months, or as short as you need it.
Yes.
Yeah, so that's because so many people graduated a long time ago, or they failed a lot and they need a while. They didn't learn what they should learn in school, and you saw the failure rate is really high.
Yeah.
Yes.
Yeah,
And
so-
then it depends on you,
So
some
I'm
people come
saying
in here
it's
and crack
now.
down.
And some people
I've
come
seen
and
some
they
of them
be
come in here,
broke.
it depends on your studying
It
stuff,
depends
some
on your
people come
study
in here and they
habits.
crack
The
down and
housing that
they
we
be
got
on it.
from the guy for this young lady right here, he actually took the television and set the television up on YouTube as well for the television for your lectures. So you watch TV regular, but you'll also be able to watch it on the HETV on the TV.
Okay.
Cause I told him it's student housing.
So I'm interested.
Where do you live?
New York.
Where do you live?
Indiana.
Oh, okay, so yeah, what we'll do, we'll talk more on Sunday, we've gotta get her situated. This one has already got her place, okay, I don't have to worry about her. Who,
She
yeah,
needed something
tomorrow, 8:30.
She needs
I
something
need
tomorrow.
something tomorrow.
Yeah, but we don't know yet, we know
Oh,
for
okay.
sure, this
For her,
young lady, yeah,
today.
yeah,
Oh, wow.
yeah.
Okay, now, one thing is, 5 months. I need to pass this test.
Okay, tell me
This
Sunday,
will be my last time for this.
Taking it, yeah.
Taking it.
Yeah.
I
I've
want
taken
to
it like
pass it.
6 times
yeah,
already.
I get it.
I want
But
to
see,
take
you're
it
gonna be
and-
okay, but for now, let's do this. Let us get you together at the housing. You're gonna follow us and just relax. We have to get this room because I
Okay.
help her.
Okay.
She didn't get the text, so she.
Oh, okay, I'm
It's a
so
lot.
sorry. Okay, okay.
But it's okay, baby.
It's okay.
Yeah, just come back and watch her, but you be upstairs.
Okay.
And it's a little bit too warm upstairs with the air on full blast.
Okay.
But it's a little toasted, so just say, okay, one day ain't gonna kill
Kill
me.
me. Oh, 2
Yeah,
days, 2 days, 2 days, yeah.
It's not hot, it's just not as cold.
That's beautiful. Yeah, I did. Come and take me this.
I love it, you look so fun.
Foundation.
Oh, she needs to get it.
Oh, you come because I really.
Okay. I didn't want to hold on now.
I'm serious. You were good.
Okay, crazy.
Yeah.
So-
This is my professor who's gonna make me pass the test.
We are definitely gonna make her pass.
And just remember when you get all of this.
Thank you.
Water.
Oh, I don't eat sugar.
She doesn't look it.
It's like, if I do, it's one little sweet little treat a day. Nothing like a bunch of carbs. No, one a day. So maybe it's a fresh apple, maybe it's an orange, maybe it's a sundae, an ice cream sundae. Maybe it's, I don't know, Reese's Pieces chocolate cake. I don't know. It's just one a day, but not a bunch. So no rice, no pasta, no beans, no breads, and then dessert.
Take one more picture.
It's okay. She's funny.
But one thing, if you didn't explain like how you started, I want to know more about it.
You're gonna get it all here at the house.
Okay, okay. Oh, you were at the house too?
No.
Oh, okay, okay.
No, but we gotta go and buy some.
Okay, okay. Okay, all right, now it's process.
That's too funny.
Yeah.
I love it.
All right, see you.